Now, I understand that there might be situations that you might be facing that are not do not escalate to a true emergency, but they still cause discomfort. So I wanted to address that today and what you can do about it. So what I did is I actually went to my local pharmacy and I went to the oral care section. And I was actually very impressed by the amount of products that they had. And the first thing I wanted to talk to you about was if you have any mouth ulcers or anything like that, there's a product, and I'm not endorsing any specific product. This is a product from CVS. It's 1.5% hydrogen peroxide. I don't know if you can read that there. And that's really what matters. So that's the active ingredient. So that's going to be really good if you have any mouth sores. And if you have to go to the dental office, it's a good idea to rinse with this product only for the short term before you go in and after you come back. The other thing is you might be grinding during this time. So if you have a night guard and you've chipped it like I did, you can go ahead and use a metal emery board. I know this is not metal, but just to soften that sharp edge so it's not cutting into your tongue or your cheek. If you don't have a mouth guard, I did find some good short-term solutions. This is one of them. This is just heated and molded to your teeth. There was one that I did not like. And I don't know if you can see that there, but this one only covers the front. And the reason why I didn't like that is because it can actually change your bite. It can actually change your teeth. And you might end up needing to have braces in the future to fix that. So if you end up using it longer term, it's just not a good idea. Now, if you're grinding your teeth, you might actually end up chipping them. So again, a clean emery board. Make sure you're washing your hands before you do this, and just to soften that sharp edge so it's not cutting into your lip or your cheeks or your tongue. If you lose a filling, there's this type of repair kit. I did find another one. You know, a lot of the products that I found were less than $30, which I found to be quite reasonable. This one was the other kit that I found, and the what it is it's this little jar, and you just have a paste that's inside. You want to make sure that you're brushing your teeth beforehand. Use Listerine or use some sort of a rinse, and then dry up the area. And I like to use gauze. You can buy this also in the pharmacy. I like to roll it up. One would go on the side of your cheek and one would go on the side of your tongue if it's on the bottom, just to keep that area dry. And you just roll it up like this and you put it on the area that has the hole. It also has this little palette, and you can use that little round area, you can see the edge there, to really kind of mold it in place and just let it set for a minute or so. Make sure you're reading the instructions. Now, if you have a crown that came off, there's other products you can use. You can use this product as well. Just make it a fine reline and just push the crown in place and hold it again for about a minute or so. If you can't get to this product, then you can use something like Fixodent or something like Polygrip. Those are also kind of gel type materials. Or you can use something like Sensodyne. Sensodyne is also really good in helping with any type of sensitive teeth. Just, you know, make sure you put it on the tooth that's bothering you and just leaving it there. I don't recommend rinsing it out. If you have an Invisalign tray, make sure that you keep using the last tray. Make sure you clean those trays thoroughly. Don't use vinegar for either your mouth guards or your trays. That will break down the material. But just keep using that last tray until your dentist tells you to move forward. The other thing that I wanted to talk about was Ambisol or Oragel. It's a topical that you can put in areas that are sensitive. If you have a tooth, baby tooth that's loose in your household, one of your kids, you can use this product around that tooth to help you kind of wiggle it out. Floss is really good. Just hug the tooth with a floss and move it around. I like using gauze as well to just hold onto the tooth as if it's slipping. That can be very helpful as well. Last thing I wanted to talk to you about is if you have brackets that are bothering you, you can use something called orthodontic wax. And again, you know, you can find it in most pharmacies. And that would be really helpful in just kind of insulating the area from any pain. We're in the midst of a pandemic, and we want to make sure that our dental patients don't end up in the emergency room. These is what constitutes a dental emergency. So uncontrolled bleeding, uh, swelling, difficulty swallowing, if you knock a tooth out, please do call your dentist. We want to conserve our emergency room resources for true medical emergencies, so that they can take care of those. And your dentist is available for you. Your dentist is a phone call away. So please do contact your dentist. They will have access to your previous records, x-rays, and all of your medical history, dental history, and they're the best person to really help you through this time. Please be safe during this time, and make sure you're hugging your loved ones and taking care of them. We are looking forward to seeing you soon. Thank you.